Hi folks, I'm Dr. Michael Jones, President of the Medical Exercise Training Institute, and thank you for allowing me this opportunity to tell you about our Medical Exercise Program Director Mastermind. Now, we started the whole medical exercise and post-rehab movement with regard to certifications back in 1994. We offered a certification then, the Medical Exercise Specialist, and a few years after that, we realized we needed someone that would serve as the director of a medical exercise training program, regardless of the setting, whether it was in a physical therapy clinic, chiropractic clinic, hospital-based fitness center, or a standalone program that was in its own facility. We realized we needed to have a professional that could market, promote, manage, administer the medical exercise training program, as well as being the liaison between that program and the medical community. Hence, we came up with the Medical Exercise Program Director certification back in 1999. Now, we haven't offered the MEPD in 2 years, and we're offering it now in January of 2019, and we're offering it via the MEPD Mastermind. It's the same MEPD program we had before, and I'll tell you about all the components in just a second. But what we're doing this time is we're going to utilize the concept of the mastermind. Now, for those of you that may not know, the concept of the mastermind came along in the 1920s. It was used by large business owners, and what they would do is come together, and business owners from different parts of industry would come together. Maybe you had someone from the steel industry, maybe someone from the banking industry, maybe someone from the oil, or maybe even the railroad industry, and they would come together in small groups, and they would mastermind, which meant they would look at each other's challenges and problems and successes, and they would use the successes and failures and challenges they had in their industry, but they would share those with individuals in other industries, and they found that solutions that maybe worked in one industry worked even better in a different industry, or maybe a failure in one industry, actually it worked out well in a different industry. So we find that the idea of the mastermind, where we have multiple individuals working together to solve problems, works well. And as a medical exercise program director, once you finish the certification and you get back to your community, you certainly want to have information that other MEPDs around the world have used to solve the problems in their facilities. And quite honestly, you'll probably find the solutions that they may offer for you are solutions that will work very, very well in your facility, but without the mastermind concept, you wouldn't have access to that information, nor that collaboration. So we're doing something a little bit different with this MEPD certification program. We're going to make it a collective. We're going to actually use it as a mastermind concept. Now, what that means is you'll still go through all the MEPD modules. You'll still be responsible for all the projects. You'll still be responsible for the quizzes and the homework. But the mastermind component now will say you're going to share information with other MEPD participants. So let me tell you a little bit more about the MEPD program or the mastermind. Now, our MEPD mastermind starts January 7th. So we're kicking off 2019 with our MEPD mastermind. And our theme for this mastermind is MET Systems, the Keys to Success. Now, many of you know I'm a physical therapist by training. I've been a physical therapist now for 33 years. I guess probably maybe third or fourth year in my physical therapy career, I decided I was going to go out on my own and open my own practice. Well, I had advanced training in manual therapy. I had gone to school at Michigan State, an osteopathic program there. I traveled to Australia and studied there. I had done all the advanced training here in the United States. And by the time I got into my third or fourth year, I was getting a little bit antsy in the hospital setting. I wanted to expand and go out on my own, so I opened my own practice. Well, folks, I was great managing the patients. That was no problem at all. But I was a hot mess when it came to the administrative aspects, the billing, the documentation. And folks, in physical therapy, if you don't document, you can't bill. If you can't bill, you can't make any money. And let me tell you, as I said before, I was a hot mess. Well, my mentor, a gentleman who had helped me get through physical therapy school, he was a therapist himself, I guess he somehow or another heard about my woes and came by my office one day and sat me down and explained to me the concept of installing practice systems. And I was like, wow. Now, I've helped medical exercise specialists and post-rehab conditioning specialists around the world developing their practices. And the one thing that we see consistently across the board is personal training, medical exercise training are two different things. With personal training, client buys sessions, they feel better, they get a good workout, they lose a little bit of weight, get a little bit stronger, fantastic. But with medical exercise training, now you've got to communicate with doctors and therapists and chiropractors. You also have to make sure that the client reaches these target goals, or what we call functional outcome measures, to show that your programs are effective. So now, instead of just simply training the client really well, now you got a lot more T's to cross, a lot more I's to dot with medical exercise training. So now you have to have systems in place. That's why we're looking at the theme, MET Systems, the Keys to Success. Now, our MEPD Mastermind starts January 7th. You can go over to MEPDMastermind.com to get more information, or you may be on the site now. If you're on the site now, just go down below and register. We only have 8 slots available for our MEPD Mastermind starting in January. Now, the big question is, are you ready to lead? Are you a medical exercise specialist? Are you a post-rehab conditioning specialist? Have you gone out there and you worked for at least a year, you've provided services, you're good at providing these services, and now you want to do more? What we need are individuals that aren't just simply the top session makers in the personal training facility, or they're not the person that has the best physique, but they're the individual that says, I understand that exercise is key in long-term management of medical conditions. I also understand that I need to be an expert in exercise and share my expertise with doctors, therapists, and chiropractors out there, as well as sharing my information with clients in the form of lifestyle education and producing exercise programs that in turn produce positive functional outcomes. So you can see, we really do need leaders, and the leader, from our standpoint, is the medical exercise program director. This is the person, as I said before, that's the liaison between the medical exercise training facility and the medical community. They're the ones that will field the questions, communicate with the doctors, establish maybe new protocols or guidelines. They're the ones that are going to be out there spearheading this movement to bridge the gap between healthcare and fitness. But they're also responsible for administering the medical exercise training program, marketing it, promoting it, and most importantly, just simply managing it overall. So with our MEPD Mastermind, we've got several components that go along with it. And if you're on our website, MEPDMastermind.com, down below I'll talk more about these components more specifically, but let me just give you a general overview. The MEPD Mastermind is designed, as I said before, for the medical exercise professional that has some experience, we say at least a year. They work with clients, and now they realize that they do have a special knack for this, and they now want to go to the next level. They want to manage, oversee, administer, but also they want to communicate more with the medical community, because certainly the medical community needs an individual that's an expert to explain to them how exercise will impact a patient's condition, and most importantly, what exercise needs to be done. That's what we need from our medical exercise professionals. So here's the MEPD program. With that, we'll have 16 live MET practice systems webinars. I'll be your instructor for that. Now, folks, over the last 24 years, I've helped MESs on 6 continents develop practices. And one of the first things we look at is the idea of getting clarity and, along with clarity, installing practice systems. We'll talk about the practice systems in just a second. These are live webinars. I will be your instructor. We're going to broadcast from our facility here in Houston, Medical Fitness Pros, and talk about how you set up these systems in your facility, and along with setting up these systems, how you implement them, where you'll have problems, but most importantly, giving you the underlying components and the inside deals and details, I should say, and information, so you can really put together strong systems. Systems, folks, is the most important thing in medical exercise training, and it's the thing that doesn't transition over from personal training. We need systems in place. Let me say this. In medical facilities, there's systems that you probably never seen if you are a patient or utilizing a system, or maybe even working in a medical facility. There's systems in place that are indigenous to the learning of medical professionals. They're indoctrinated into us. And over the course of my first few years in private practice, I realized that these systems are universal in any type of healthcare setting. Now, we're not saying you're healthcare professionals, but certainly you're trying to produce health-related outcomes. So we have to have some of these systems in place in the medical exercise training facility. Now, along with those webinars, after those webinars, later on in the week, we'll have a conference call, the MEPD Mastermind conference call, where we'll talk about your challenges in implementing these systems in your community. Now, as I said before, there are a number of systems. We'll go over those in just a second, but I realize for a medical exercise specialist, say in North Carolina, your challenge may be different from a medical exercise specialist in California. So when we get on these conference calls, we'll have guidelines with regard to how to implement and install these systems, but we also have to look at the different nuances of your facility. So we'll help you with those challenges. That's where the mastermind, the collective, really becomes important. Also, you'll get access to advanced MET assessment modules. Now, I talked to a young lady, one of our PRCSs, that is also now a facility director of a medically based fitness facility owned by a hospital in North Carolina. One of the things she told me was that all the trainers that are in the facility use different guidelines with regard to assessing their clients. Could you imagine being the medical fitness director? You're trying to go out and market to doctors, therapists, and chiropractors, and all your staff members are doing different types of assessments. So when it comes time to sit down with a therapist or a chiropractor or a physician about a client they've referred, you now aren't 100% clear on what the fitness professional did as far as the assessment or what the goals are for the program, but more importantly, what are the targeted functional outcome measures. We need to have a systematic process whereby we assess the medically based client. And certainly you can add additional components, you can take away components. So we're going to give you access to advanced MET assessment modules where we'll get into things like manual muscle testing, goniometry, not to take the place of the medical professional, the physical therapist or the occupational therapist or chiropractor, but to give you more information so you can produce a better outcome for your client. We'll also give you access to a private Facebook group. Folks, I've been amazed at what's been done in our private Facebook groups for our MESs, our MedX Pro network, in that individuals now can communicate 24 hours a day, 7 days a week across continents and share information. And we found that these private Facebook groups, which we'll have one for the MEPD Mastermind, are amazing in the sharing of information, the collaboration, and most importantly, developing camaraderie. Because we realize a lot of times you're out there on your own. You're the lone ranger in your community offering medical exercise training services. And if you're now going to become the director of a program or open your own program, you become even more isolated. So that private Facebook group will be available when you become part of our MEPD Mastermind. You'll also get access to the recordings of our 2018 MedX Pro Summit, which is held right here in Houston, and you'll get access to either attend or listen or watch online for our MedX Pro Summit 2019, which will be right here at our facility here in Houston, Medical Fitness Pros. Now again, our MEPD Mastermind starts January 7th. Now, it's $2,000. You may say, well, Dr. Mike, that's a lot of money. Yes, it is. But with what you're going to get and the ability that you're going to have to manage, develop, market, administer, and most importantly, be the liaison between the medical exercise training facility and the medical community, folks, that's invaluable. Because the one thing we do know, medical exercise training is going to get bigger and bigger over the next 20 years. I guarantee you. So we're even going to give you some payment options. You can make one payment of $2,000, or you can make two payments of $1,000 each, or we have a 4-payment option, $500 with each payment, or 6 payments of $333. Now we realize the holidays are upon us and you're running your practice. You've got to pay all the expenses, you've got to pay taxes, you've got all kind of stuff going on, and you've got all of your household bills and expenses. We realize that's why we put the installment plan in place. If you're not on our website right now, please go over to MEPD Mastermind. There are, as I said, payment options at the bottom of the page. Take advantage of those and start really being the person that's the leader in your community in bridging the gap between healthcare and fitness. But let me tell you about these systems. As I said before, the MEPD Mastermind teaches systems for client management, practice operations. So when we talk about client management, everything that has to do with the delivery of medical exercise training services to the client, whether it's group-based, whether it's a medical membership or one-on-one training, we actually have a system for that. Also, practice operations. The operations portion of your practice, because you're now, to a degree, medical, or I should say more of a wellness-based facility, you now have to have your facilities and your operations at a higher level. Now, the standard for cleanliness, say, in a health club setting is a lot different than with people coming in with medical conditions to exercise. So we're going to look at the idea of security. We're going to look at the idea of equipment maintenance and equipment management. We're going to look at the idea of things like HIPAA guidelines. These are all part of the operations system. We also talk about medical relationships. It's great to send a marketing packet to a doctor, but how do you now keep the doctor, therapist, or chiropractor engaged so that they are willing to refer clients and you do develop a relationship? We've got a system for that. We also have a system for marketing. Marketing shouldn't be just simply, let's go knock on doctors' doors and therapists' doors and hope they're going to send clients. We also need to look at the idea of utilizing social media, but also marketing to the general public. The one thing that I've learned over the last 24 years is the most powerful component in the healthcare system is the patient/client themselves. You may have a hard time getting in to see the doctor, therapist, or chiropractor, but if you market it, you can attract the patient/client. They now can be your liaison in getting you in to see that doctor, therapist, or chiropractor. So we'll go over that system. We also have systems for documentation and communication. What do you document? When do you document? What forms do you use? And when do you communicate this information to the doctor, therapist, and chiropractor, and exactly how? We also have a scheduling and billing system. Now, scheduling clients is pretty easy, but some of you may even get to the point where you're dealing with insurance carriers. That now means, how do you bill the insurance carrier? Obviously, documentation and communication become part of that. And this billing isn't to try to replace physical therapy or bill for physical therapy services, but we have found that insurance carriers are willing to pay for exercise after physical therapy, chiropractic, and medical care are done because they realize it's good money and a good investment in keeping the client at a functional level. Also, we'll go over staffing and education. Now, I run into medical exercise specialists all the time that are having they developed a great practice, they're getting great outcomes, but with that, the problem is now they're getting so busy, they need to look at staffing. Well, here's the problem. You can't clone yourself. Everybody wants someone exactly like them, but you can't clone yourself. In this day and age, cloning isn't acceptable. Obviously, it's not really possible. So we're going to talk to you about a system with regard to how you can staff your facility, but also how you can educate your staff members so they can produce the same outcomes that you have. And we'll also have a system that will talk about MET assessments. Not only the assessment procedures, but how that assessment should be conducted so that you get the best outcome. Then you can also report that outcome with regard to the assessment to a doctor, therapist, or chiropractor. Now, these are some of the modules. Now, these modules are vitally important. We added these modules because we feel like the medical exercise program director should have a knowledge base that far exceeds the medical exercise specialist or post-rehab conditioning specialist. So we have additional modules, advanced guidelines for the knee, shoulder, and spine, with also some cadaver dissection here. That's done by a video, I should say. We also have a segment on pharmacology, one on ergonomics, and essentials for senior fitness. And as I said before, additional modules on medical exercise or MedFit assessments. They go into far greater detail with regard to testing procedures, range of motion, manual muscle testing, things along those lines. Not again to diagnose or to treat the individual coming in, but so you can get a better understanding of where they are, establish a baseline, and then produce positive functional outcomes for the client. As I said before, we'll talk about these MET practice systems, operations, client management, assessment, documentation, communication, marketing, medical relationships. We even have a segment that will talk about the business plan and, again, scheduling, billing, staffing, and education. All of these are essential components in a highly functioning and medical exercise training facility that produces positive outcomes. Now, we said earlier these MedFit assessments, we have assessments for these regions of the body, and we go into those in great detail. We also have quizzes that go along with each of these modules, and these modules are in detail, and they give you very, very in-depth video coverage with regard to showing you how to do these assessment procedures. So this is vitally important. And the whole idea of this MEPD Mastermind is to bridge the gap between healthcare and fitness. As you can see here, we have a medical professional. Obviously, he's got a chart in his hand. Now, the medical professional understands all the aspects of pharmacology, medical management, radiology, and reading x-rays, and reading MRI reports, writing prescriptions, doing surgical procedures. But you also see this medical professional has a dumbbell in his hand. This is where you come in. We realize now that exercise is probably one of the most important keys in long-term management of medical conditions, and we need someone to be the liaison between the medical community and the fitness facility. That's you, the person that wants to be a medical exercise program director. We need someone now to be that liaison, be that expert that the medical professional comes to and says, hey, I have a patient that has X, Y, and Z. Physical therapy is now done, chiropractic is done, we now need an exercise program. Can you give me some guidelines on what we can do, or can I just simply refer that client to you? We need someone to be that liaison, that conduit. That's where the MEPD Mastermind comes in. So please, if you would, if you're on our website, MEPDMastermind.com, go down below and get registered. Again, we start January 7th. We only have 8 slots available. This program is going to run about 4 months. And it's a detailed program, so you will have homework assignments. You will have 2 additional projects. One project will be developing a fictitious business plan for a medical exercise training facility, so you do understand how to put these programs together. And another project is you will have to make a presentation of a medical exercise training or post-rehab related topic and present it to a group of your peers, fitness professionals, and videotape it. Because as a program director, one of your jobs is to go out there and market the facility, promote the facility, as well as being that liaison between the medical exercise training facility and the medical community. So please, if you would, go to MEPD Mastermind, get registered. Again, we start January 7th, and 2019 will be our 25th year bridging the gap between healthcare and fitness with our MES, MEPD, and PRCS programs. Our medical exercise specialists and medical exercise program directors and post-rehab conditioning specialists have done a fantastic job out there bridging the gap between healthcare and fitness. So to all of you out there who've gone through our programs, I wish you the best for the holiday season. I also wish you the best for 2019, and thank you for the great job you've done. But now we need more leaders. We need individuals now that are going to lead this movement to bridge the gap between healthcare and fitness. So please go to MEPDMastermind.com. If you're on the page, go down below, get registered. We have payment plans available. And please, all the best to you and best wishes building your medical exercise training practice. Hopefully, we'll see you in the MEPD Mastermind. All the best, folks. Bye-bye.